Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
Little back pain on my left when I stretch forward.
How long has it been going on?
6 months.
6 months. How did you hurt your back?
Working.
So you're working with the patient, you're a physical therapist?
Yes, I felt just a little, like nothing, but it's just like a little stretch.
A little stretch. So have you had any treatment on your back in
Yes.
6 months?
I did myself, of course.
You worked on yourself?
I worked on myself.
Yeah, that's difficult, yeah.
Well, you can do a lot.
Yeah.
Economics and just stabilization. Of course, I went to my colleague, physical therapy, but didn't know how to manage really in between, so it got worse and worse. It gets worse and worse.
Can you give me a little bit background? You physical therapist, were you practicing? And
I practice in my own practice. I work like 6-7 hours a day, 4 days a week.
Where are you from?
Switzerland.
Welcome. Yeah, use it as a vacation here.
Yes.
It's beautiful here, yeah. So, how much pain do you feel in your back, and what can we do to aggravate your symptoms?
It's got really much better. Now I can, I have a little pain on my low back when I stretch forward.
0 to 10, how much on average? So it's
like when I do any, I don't, like now I don't feel anything.
So when you bend forward?
It's just bend forward, I feel everything.
Okay, any other motion that aggravated squatting or?
I don't think so. And now I have a little 2 on the left.
2 out of 10?
Yes.
Okay. Let's extend. You're very limited there.
I have a little pressure, but not much.
Okay, can you do twist left and right and see how much?
Little stretch, muscular stretch around.
But no pain, yeah?
Pain, just around the ribs.
Okay, side bend left and right.
Okay, just a feeling here. Stretching, but no pain, just a stretch.
So it's most likely with flexion, yeah? So I'm using the A1 now. Okay, I'm gonna use the A2 so it will make sense to you. You feel that fibrosis here?
Yes.
Okay. It's right on your iliac crest here.
Okay.
It's a very common area for the low back. And here. Is that sensitive or it's okay?
It's sensitive, but no pain.
No pain, okay. It's not too bad here. This is very fine, like nothing here.
Yes.
You have a little bit in here, but this, yeah. You can go down and how does that feel?
No more pain.
It's gone?
It's gone.
Okay, let's do 5. We'll have you do all the range of motion just to feel. How's that feel? How's that?
A bit better.
Gone or is still tightness?
I feel a bit in the hamstrings.
In the hamstring, because we did not work on it. So we need to work on the hamstring. So let's do the twisting, but that area that you complained of, we're fine, yeah?
Yeah.
And side bend and extension.
Better.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.